Welcome to From Betrayal to Breakthrough. I'm Dr. Debi Silber, and today's guest is Dr. Tom Moorcroft. And Dr. Tom Moorcroft is board certified in family medicine and osteopathic manipulative treatment. He specializes in uncovering the hidden toxic burdens, preventing people from healing from chronic Lyme disease, mycotoxin illness, and infection-induced autoimmune encephalitis, so they can start feeling better quickly. Many of his patients have had their experience of suffering be dismissed by the conventional medical system. Addressing this betrayal is critical to their healing. His goal is to empower patients to take the steps necessary to get in touch with their inner source of healing so they can experience optimal health. And if you've ever gone from doctor to doctor struggling for answers and only getting sicker and more frustrated, you're going to love this conversation. Dr. Tom will be talking all about a unique type of betrayal, the betrayal of the medical community. You may need to stop and take notes during this interview because Dr. Tom will be dropping some incredible truth bombs along with how the gut, heart, mind are all interconnected and how one truly impacts the other. Get ready. Here we go. Oh, I am so excited for today. We have Dr. Tom Moorcroft on. And yes, so often we talk about being betrayed by a family member, a partner, even ourselves. But today we're going to be talking about being betrayed by the medical community. So welcome, Dr. Tom.
Hey, Debbie. Thanks so much for having me.
Thanks for being here. So that's a pretty bold statement, being betrayed by the medical community. Nothing like diving right in. What do you mean?
Right. Well, a lot of the people I see are folks who have kind of been told it's all in their head, and they've been suffering with different things, like maybe it's joint pain, it could be chronic fatigue, emotional stressors and things like that, even like brain fog. And the community, they go to their doctor and they're just like, oh, you need more sleep or you need to take a vacation or, there's really nothing wrong with you. So go see the psychiatrist. And they kind of leave it at that. And so I found that a lot of people really feel like they've been betrayed, by the system. And it's not so much that the system's doing the wrong thing on purpose to them, but it's often that their symptoms are so complex that they don't understand it, and so it's just one of those things where just because I don't understand what's going on with you doesn't mean that it's all in your head. Maybe it just means that together we have to work to figure out what might be going on.
And I imagine by the time someone comes to you, they're so exhausted because it's not that they're not trying to heal. They're going from one thing to the next or listening to whoever sounds like they're making sense. And who's the typical person that comes to you? What are they coming in with and what are they struggling with?
Yeah. Well, I think that the typical person is seen somewhere between like 5 and maybe 30 different doctors, and they really haven't found that unifying diagnosis. Most people at the moment get to me for they think they may have Lyme disease or a related tick-borne infection. Some of them have mold exposures at home. I see a lot of children with there's an acronym out there, Pandas and PANS, and they basically describe infection-caused autoimmunity and especially causing brain inflammation and behavioral changes. And
okay, so I'm going to stop you right there because can you explain to everybody what Pandas and PAN, what is that?
Absolutely. So Pandas is an acronym for Pediatric Acute Onset Neuropsychiatric Disorder after Streptococcal Infection. So,
well, of course it is.
Of course, right? And so we had to come up with an acronym because you can't say that all day. And what happened was this came out of, there are some people who will have a thing called Sittingham's chorea, which is weird sort of dance-like movements that come on after a streptococcal infection. And then we saw acute behavioral changes often accompanied by food restriction or by bedwetting, in an inappropriate age group kind of come on overnight. And it was associated with having had a strep infection recently. Mm-hmm. Subsequently, they found out there's a lot of other infections that can do that. And that's where they came up with the acronym PANS, which is Pediatric Acute Onset Neuropsychiatric Syndrome. And that's sort of a broader arching category, just allowing us to realize that, things like a yeast, infection may do it, something like a viral infection, tick-borne illness. And so just allows us to broaden our sort of, viewpoint of it to see what the possibilities might be. And essentially what happens is you get these infections and they trigger like hyperimmunity. And then so your body starts having an autoimmune reaction against predominantly the brain, which leads to all kinds of neuropsychiatric behaviors like anxiety and rage, and even tic disorders like tics, like in Tourette's syndrome, or a lot of times kids will have a vocal tic. And this is where the children go into the doctors and they're like, hey, last week I was fine. And then I got sick over the weekend. And then Tuesday morning, I just woke up and this kid has brand new rage and they have OCD and they won't come out of the bathroom because they have to wash their hands over and over. And this is the part where that sort of, if the physician or other healthcare provider isn't really well versed in this and they don't pick it up, they might miss it and say, hey, look, you need to go to the psychiatrist, when really it's an infection caused psychiatric issue, not a primary psychiatric issue.
Wow. And so now here I can just picture this scene. Here are these parents now who are they're so confused. They're saying, well, they were feeling okay, and all of a sudden there are all these new behaviors showing up, and it seems to be presenting itself, I guess, mentally and emotionally. So they're just being told, and I guess on some level it makes sense. So they go to the psychiatrist, and what happens there?
Well, a lot of times, this is one of the things I think is a real key, is it doesn't make sense to them. Like, so a lot of times I'll talk to the psychologist and they're like, this makes no sense. This kid is not like your typical OCD. Mm-hmm. This is not the normal child that I see coming through my office. And so, but a lot of times they're just like, it doesn't make sense like in a 8 or 9-year-old to have like OCD brand new out of nowhere. And so that's what they're noting. And then they're going, hey, as I look through the symptoms, well, they might blow off sort of the bedwetting, or, oh, they're not eating, but that's because something changed. And these are really cardinal things to be aware of. And fortunately, a lot of the psychologists and some of the psychiatrists are starting to know more about this PANS phenomena than even some of the pediatricians out there, because they're seeing them. They're becoming the frontline provider, because the rest of the system says, we don't understand what's going on. You have a psychiatric issue, go see somebody skilled in that area. Mm-hmm. So,
this is amazing. So then what happens? So then they go on medications for what? To treat? Right. Go ahead. Instead of me guessing,
that's funny that you say that, because that's like when people come to my office, I'm like, yeah, why'd you go on medication?
Right.
Well, and so I think that it's one of these things where they start therapy. And I want to be really clear with folks too, is I'm not against using the medicine to help stabilize the psychiatric issue. I mean, I have kids who become acutely suicidal. And let me tell you, unless I'm like really on the money that day, or we get super lucky, we may not be able to address the underlying cause, in a couple of days. And, when someone's acutely suicidal, or, they have a huge extreme of their psychiatric symptoms, I'm not saying don't do the therapy, don't do the medicines, but also once you do those things that are medically appropriate, also continue to look for the underlying cause. Mm-hmm. And people with lesser symptoms, they're more mild. They're the people where I'm like, well, hey, maybe we have some time. We might use some therapy along with some natural treatments to help balance their mood while we're trying to identify and treat that underlying cause.
Mm-hmm. And when you say therapy and other types of treatments, what do you mean? Can you give us some examples of what that would look like?
Sure. I mean, it could be anything from some of the local people work with do QEEGs and then use neurofeedback. Certainly cognitive behavior therapy may be reasonable in the right situation, and sort of those kind of things. When I see people, I really like to look at them through the lens of what's called Polyvagal Theory, where instead of just saying the sympathetic nervous system is fight or flight and the parasympathetic is a social engagement, relaxation, rejuvenation, we realize that there's a third part of sort of the way the body automatically responds to things, and that's to freeze. So if you don't feel like you can run away and be safe, and you don't feel like you can stand and fight for yourself, well, the only thing left is to play dead and freeze. And you feel hopeless and numb and helpless and really shut down. And in that case, Stephen Porges, who came up with the polyvagal theory, has some different, treatments that they use with sound and guided imagery and stuff that can be done, over a period of a week. And it can sometimes, in someone's office, and it can lead to some really dramatic changes in opening people up and getting them back to sort of reconnect with themselves, being present and being compassionate and feeling joy again. So it's pretty cool stuff, but there are a couple examples.
And walk us through. So someone would come in with what kind of symptoms, and let's just say they did some of these treatments and therapies. What would be the difference that they feel?
Well, in the case of all these things, is the goal is to just sort of, in my mind, and granted, I'm not a psychologist or psychiatrist. I mean, I have some training in some of those things, but for me, it's really about being really connected with who you are, being present in the moment, and to really be able to feel the connection of your whole body, particularly with your heart, so you can feel joy in your life. And I think that in my patient population, what I see really commonly is that when they talk about Lyme disease or Pandas, it's sort of, they talk about it as if they and the infection are the same thing, or that they and the autoimmune process are the same thing. And that's really not true. So whenever I have someone doing therapies, I would like to see them have the opportunity to recognize what part of this is the disease process, initiated by the infection, and what part, and then where that they are actually separate from that. So I'm someone who's having Lyme disease, or I'm someone with Pandas, but Pandas is not who I am. And I think that all of these different therapeutic approaches, that's really the goal, is to get you more grounded in who you are and realize there's things happening in your life, but that's not who you are. And when you identify wholeheartedly with your disease process, and then it becomes really hard to recover. And that's almost like an accidental self-betrayal, because you're forgetting who you are, and you're becoming more identified with that disease process.
I've seen that so many times where the women that I've worked with, they've attached so strongly to their disease, they couldn't imagine who they'd be without it. And if you can't imagine who you'd be without it, that's your identity. It's going nowhere unless you can sort of make peace with who you'd be if it weren't there.
Well, right. And I agree totally. And that's what I see. And I see it happen not as much with the kids. I think a lot of times the kids I see who get really attached to it, it's kind of because their parents are really attached to it and they get there. But in my adult women and the men, I see the same exact thing that you're talking about. It's almost like we have a chance to create barriers for ourselves. Like I remember like growing up, like it was always hard to stand up for yourself. You always wanted to be fit in, and you always wanted to be in the in crowd. So you kind of like say yes, maybe more than you should. And, it's like if you're sick and you don't, and your friends call you up and you want to go out Friday night, like, look, really, I can't, my Lyme is acting up. Rather than standing up, say like, look, Friday night, I'm not available, or I don't feel like going out with you guys this week. And that's just going to be the way it is. It's sort of like, oh, my Lyme is acting up. My kid's Pandas is acting up. They can't go to the birthday party. And so then we start to use it almost as a defense mechanism for other things as well. And so that's so hard to step away from. So I'm always that's why I'm saying, if someone has a medical condition that affects them psychiatrically, let's find a therapeutic program and create a team around them to help, because we see this in psychiatric conditions, we see this in chronic pain, and is that the more this symptom occurs, the more likely it is to occur, And so it's almost like a feed forward loop where it can eventually become self-perpetuating. And I would hate for somebody to be exposed to strep and accidentally, and then just go, oh, it's only strep, and I'm just going to take my antibiotic or my herb for the next 6 months or whatever, or 2 weeks, and then get stuck having anxiety that lasts for the next year or two, because we didn't also address that anxiety at the same time.
Wow, that's so important. And when you say about antibiotic, I automatically think of the gut. How is the gut related to all this? How is it impacted? What goes on?
It's critical. We hear more and more about the gut-brain interaction and the gut-brain axis. But what we know is there's been some studies out there showing something as simple as fast food or consumption or eating commercial baked goods can increase your risk of depression by over 50%.
Oh, wow.
which is just like incredible. And what happens is, at least to the best of our knowledge, what's happening is we have the microbiome, which is a way we describe all the good beneficial bacteria and fungus in our gut. And they react with what's called the enteric nervous system, fancy way of saying the central nervous system of your gut, and those feed back to the brain, and they control the release of substances like serotonin and GABA. And like serotonin is one of our happy drugs, right? So if you go to the conventional doctor and they might put you on Zoloft or Paxil, Prozac, things like that, and they're serotonin reuptake inhibitors. And basically we want this happy drug, serotonin, to sit around and bathe the brain some more so you're happy.
And you know what, Dr. Tom, I want to stop you right there because when it comes to betrayal, there's so much anxiety and stress and overwhelm and chaos. And so often people will go to their doctors and just to, I guess the intention is to help them just get through it. They'll put them on a mood stabilizer, an antidepressant or something. Yeah. So talk to us about that.
Well, so what's really interesting is if your gut is off, your serotonin is going to be off. And the other piece you mentioned is anxiety. Mm-hmm. And GABA is an inhibitory neurotransmitter. Fancy way of saying all of us have a little bit of anxiety that's normal because that's just part of how we interact with the world so that we can identify danger. But what we usually call anxiety is like too much anxiety, right? And GABA will actually help the brain modulate how anxious you get. And these two substances in particular are directly controlled by what's going on in your gut. So we add commercial processed foods, we add antibiotics. These things have the potential to alter that and then change and dysregulate that, serotonin, GABA in the brain. The other part is they've more recently found that there's pathways from the gut up the vagus nerve to the centers of the brain in the limbic system, which is kind of like where we process a lot of memories, but also fear and anxiety. And so if we're changing what's going on in the gut, it changes our ability to create new memories, retrieve old memories, and also to deal with fear properly. So I have to stop you right there because now think about this, just relating back to betrayal. So your gut, the way your gut is reacting and responding can impact the way you're processing memories. Is that what you're saying? Absolutely. Absolutely. It's like a direct connection. And actually they were able to, middle of this year, they were actually able to find the pathway that it happens and surgically clip it so that, in mice, so they literally couldn't make these new memories. And then they went back and they said, look, if we change the gut, we're going to impact our ability to make memory. And the other part that's really interesting is other researchers have found that if we alter our gut, and this study was with a standard American diet food base, we will change the bacterial content in our gut, will lead to leaky gut phenomena, which is going to then feed back to the brain, and it will help break down the blood-brain barrier, which protects our brain from outside invaders, essentially, and keeps our brain safe from our own immune system. And then subsequently, it's going to mess with this limbic system where we have this hippocampus and amygdala that are all about our memories and fear and our reactions. So it's really interesting. And this part of our brain is really critical. I remember reading a study one time where there were people in the study were said, hey, you're going to play a virtual game with two other people. And the three of you are going to throw the ball back and forth between each other. And after they played for a few minutes of just back and forth, the researchers would would have the other two people not throw the ball to the third person. Mm. And what they did is they took the third person, they put them in a brain scan, and they found out that this part of their brain lit up, this limbic system and a few other parts of the brain, but has a lot to do with betrayal, fear, anxiety. But what was really so incredible about this whole study was that the other two people playing were just computer models. There weren't even people. Wow. So when you believe someone dissed you or betrayed you, you have biochemical changes in your brain that lead to changes in this limbic system. And the part we haven't talked about yet is not only does betrayal make these changes in your brain, and your gut can make similar changes in your brain. But if you have that change in your brain, the brain feeds back to the gut and screws up the gut some more. So it's
it is so amazing that you're saying this, because I clearly remember, what was that game? Monkey in the Middle, I think it was called.
Yeah.
And when, right? And I just pictured myself in the middle during that Monkey in the Middle. And I always remember hating that. And you just mentioning that, I brought it right back. And I guess that's it. It is one of those things you feel excluded. You feel like you're being betrayed. Like, hey, why aren't I included?
Right.
We just feel like we're excluded. Wow. That's just amazing.
It is. And, I think that when we look at what's going on, people, and especially with the way society is in the last couple of years, there's so much betrayal. There's so much, oh, you don't fit in with me. And, it also reminds me of another study, and just the way the brain works and its relationship to the gut. And then is really interesting to me, because there's this researcher, I believe it's at the University of Pennsylvania, but this guy by the name of Andy Newberg, who does he's a neuroradiologist who does lots of cool brain scans on people. And what he did was he took people who were advanced Buddhist meditators, and he had them meditate until they're at the height of their meditation. And then they gave a signal, and they did a particular brain scan. Then he also took Franciscan nuns who would pray so deeply that they, were there at this height of ecstasy of prayer, and they would do the same scan. And what they found was, in both groups of people, one part of the brain consistently, its activity turned down, and in another part of your brain, it turned, it got really lit up. It was really metabolically active. And so they asked these two groups, well, what were you experiencing? And so the Buddhist meditators were like, hey, we felt nirvana. We were connected with the entire universe. And the Franciscan nun said, God was speaking directly to me. And it blew my mind, because biochemically, the exact same thing was happening to each of these people. But because of their unique viewpoint on the world and their personal life experience, they had a different individual personal experience. And so, first of all, just from a perspective of religious tolerance, it really was like eye-opening for me. But it reminded me that just because someone else is using different words and they're reacting to what, an experience different than I am, it doesn't mean that I'm right and they're wrong, or vice versa. It's just that that's their experience and this is mine. And man, did it open my eyes to, I'm just like, how many times did I accidentally play Monkey in the Middle with somebody? Just because I didn't realize we both are individuals who experience life differently, despite our actual physical experience being identical. That really, really is. But what's so empowering about that message is, I'm sure when they were both groups were in that state, there was so much physical healing going on. For sure. Absolutely. Yeah, because there's no doubt at all. Because of what they were doing. That's really incredible. So can you just really distill down and sum up for us because it really sounds like the gut, there is so much potential for health if the gut is well, and yes, in our emotional wellness. So what is really sort of jacking up the gut, and what can we do to just help it heal? Well, to sound like kind of it's funny. I think the number one thing is to, shop in the supermarket along the outside. We need moving away from the processed foods, the simple sugars and the sodas and such. That's really going to be very helpful to start. The other thing is, we know that sleep and your gut health are directly related to each other. If your gut is off, you don't sleep well. And if you don't sleep well, your gut doesn't work. So some of the tricks I have people do to get better sleep is, work with your healthcare provider if you need help sleeping. But things like turning off the Wi-Fi at night and turning off your screen, an hour, preferably 2 hours before you want to go to bed, will help you sleep better so that then you can heal your gut. And that's like free healing, which is great. Turn off the Wi-Fi and turn off don't look at a screen for an hour before bed. You're going to sleep deeper, and that's going to heal your gut, which is going to allow you to heal your brain and your emotions. So that's a nice place to start. And, de-stressing, whatever that means for you, whether that's meditation or exercise, prayer, whether that's just taking a walk in the morning by yourself or with your family or your dog or whatever, stress is just roto-roots the gut. So we need to, do the simple things to help de-stress. And one of the things that I've personally been really bad at in my life with de-stressing is to learn how to say no. And so, I've had Lyme disease. I didn't use it to say no, but as I healed and started treating patients with it, I was like, hey, I need to say no so that I can actually have time for me. We're so much giving to other people. We have to remember to treat ourselves well as, also. And so I think that that's important, finding time to do something that you really love and enjoy to help you de-stress so that your gut can heal, and then you can heal that. And just as I say that, I remember that gut reaction we all have, that is like a real biochemical thing that you are experiencing emotions in your gut and feeding back to your brain. So just another thing is listen to your gut.
And, I have to tell you, when it comes to betrayal, when I was doing my study, every single woman in my study described their feeling with some sort of gut description. I felt punched in the gut. The wind was knocked out of me. I couldn't breathe. I was nauseous. And then, so that was even just the description. And then almost every single one of them had significant gut issues.
Absolutely. And, the one part that we sort of touched on, but leave out a little bit because there's not a lot out there about the gut brain heart axis. But when you look at that, how I mentioned the polyvagal theory, one of the most important pieces to get yourself is what they're describing is the way the brain connects to different parts of this vagus nerve of ours. One of them goes directly to the gut primarily. The other one primarily goes to the heart. And what they found for getting you back to healing and out of that hopeless, helpless, shut down, numb feeling is to get you more socially engaged, but to also to reconnect the heart with the gut. And the pathway for that is actually through the brain. And so it's really critical to just give yourself an opportunity to do the things that you really love in life. And it's almost like as you open your heart and experience some more joy, your gut will open up. And the more your diet is a little bit better, you take little steps and maybe, ditch the sodas, and a month later, you start to get rid of some of the other processed foods and you start to heal your gut, then you're going to start to feel the heart open up even more. And then, so you're going to have this give and take up and down with the brain as the midpoint. And so,
what I love about what you're saying is whenever anybody is asked to change their diet, they're like, all the things I can't have, and just for the sake of looking better, forget it. But what you're saying is it's not. Yes, that's a benefit, of course, but holy moly, you're going to not only are you going to heal your gut, it's helping your emotions, it's helping your brain, it's helping your heart. That's some real incentive right there.
Yeah. It's so critical. And, this is kind of a rabbit hole that just keeps going. But, how we were talking about sleep relating to the gut. Well, the brain detoxifies primarily while you're sleeping, like something like 90% while you're asleep. Mm-hmm. So if you're staying up all night freaking out because you're researching your illness or you're trying your best to deal with your anxiety, that's going to decrease your ability to actually heal from those things. And one of the things you can do to help yourself sleep better is go, hey, I can change my diet. So literally your diet can change the way you sleep, and it can change your anxiety. It can change your mood in all positive ways. And so there really is this, I keep looking at these like diagrams, from the brain to the gut to the heart and all this, but really, like going back to the people that you surveyed and studied, they know all this stuff we're talking about is something that our patients actually have experienced, and someone else told them they were wrong. Mm-hmm. And the problem is maybe 10 years ago, we didn't know what we know today, but today they're right. And so that means they were right 10 years ago. We just didn't know they were right. And that's where sort of being betrayed by the medical system, happens because a lot of times we're like, if we don't know it, it's not to be known. And the tact I take is, this is what we know now. Mm-hmm. We might know more later. This seems like very reasonable that you're having a real gut reaction to your experience. And the worse your emotions are, the worse your gut functions. And as your gut gets better, your emotions feel better. And so I try to really listen to people, and I encourage them to partner with people who will validate their experience. And, certainly.
Absolutely. And I think it's really appropriate to say the gut never lies. I mean, in so many ways.
No doubt.
Right? Absolutely.
Yeah. So, and I mean, the only other piece is I always like to try to balance what I say, because it's my job is not to have people come in and just go, yep, exactly. Everything you said is correct. I had a bunch of people that I talked to today, and their guts, they came in primarily for anxiety and emotional stuff. It was 3 kids in the same family. And, they had been treated for tick-borne illness for a long time, but they were still sick. They got a little better, but they still had so many emotional things going on. And I said, look, we got to look at the gut. And we did stool testing, and they're just, their guts are a mess. Mm-hmm. So we're going to work on that. And I just think it's important that, when we say we want to go to people who validate our experience, I want someone to listen to you and really, with compassion, but also with some science behind what they're talking about. Because sometimes people are like, it's all my Lyme disease. I'm like, no, it's really not. It's this other thing. But yeah,
brilliant. Just brilliant stuff. Dr. Tom, how can we learn more about you? Where do we go?
You can go over to my website. It's originsofhealth.com. And that's the primary place. And then also, I'm really excited just because I've seen so many people with having these issues that we've been talking about today and feeling betrayed by the medical system. We actually have a Facebook group that people can join. It's all free, called Empowered by Lyme. And it's been going on, and it really took off. And it's a group of people who are really supporting each other through whatever they're going through. And so certainly people don't have to have Lyme disease or something similar to benefit from the group. And really the whole idea behind it was to support people saying, this is my experience. I want to move forward and get better with the help and support of like-minded individuals. So thank you.
That's so wonderful. That's so great. Dr. Tom, I want to thank you so much, because I know there are so many people listening who are thinking that they're crazy because they can't get an answer or they don't feel well and they just don't know where to go. So it's just incredible experts like you who can absolutely shed some light on what's really going on. So I just want to thank you for your time.
Oh, you're so very welcome. And thank you for doing this. If it wasn't for people like you getting the word out, people wouldn't have access to all this great healing. So, thank you so much for everything you do, Debbie. This is amazing.
Wow. Did you learn a lot during that conversation? I did. And what I love so much about what Dr. Tom said was how healing the gut helps heal the emotions. Stay in touch with Dr. Tom by visiting his site, originsofhealth.com, and check out his Facebook group too, Empowered by Lyme. Don't worry, we'll have all of his links in the show notes at pbtinstitute.com/podcast. Here's my biggest takeaway. Sometimes mental emotional symptoms stem from something physical, like an infection, and it takes a skilled professional to identify the root cause of something so it's treated and handled at the roots. Speaking of handling things at the roots, let's see what you're working with. If the pain of betrayal is keeping you sick, sad, and stuck, you may be struggling with post-betrayal syndrome. Take the quiz and see at pbtinstitute.com/quiz. And let us support you. Go to Facebook and join our group, Women Hacking Betrayal, where we give information, tools, and support to help you move forward and heal once and for all. Can't wait to be with you next time. And here's to your breakthrough.